Mr. President, I would like to engage Senator Klobuchar in a colloquy to commemorate Rare Disease Day in order to discuss issues facing patients and their families who have been diagnosed with these types of conditions. As co-chairs of the Rare Disease Caucus, Senator Klobuchar and I have worked hard to bring more hope to patients and their families who are coping with rare diseases on a daily basis. Today, 1 in 20 individuals worldwide is living with one or more of the 7,000 rare diseases, 95% of which do not have an effective treatment. While the incentives provided in the Orphan Drug Act, first championed by myself in 1983, have led to the approval of nearly 600 orphan drugs, much more needs to be done. Many patients living with rare diseases rely on the FDA to evaluate and approve treatment options for their conditions. That is why it is so important for FDA to use its authority to accelerate the evaluation and approval of drugs for treating rare diseases, and for Congress to ensure that proper incentives exist for research to discover and make treatments and cures available for this community. To address this issue, Congress passed the FDA Safety and Improvement Act of 2012, which refined and strengthened the tools available to FDA to accelerate the evaluation and approval of new drugs targeting unmet medical needs for rare conditions. I've been paying close attention to how this new authority translates into advances for patients suffering from conditions such as Duchenne muscular dystrophy, atypical hemolytic uremic syndrome, Bertrand glycanase deficiency, and other rare diseases. In light of these changes over the past few years, I will ask my friend from Minnesota whether the current approval process is achieving its goals of safety and efficacy without hampering the development of new therapies.
Well, thank you, Senator Hatch. I'm so proud to be the co-chair of the Rare Disease Congressional Caucus with you, and I share your concerns, and I think there must be improvements that are made. And I continue to be inspired by the families across my state and your state and our country that work so hard to make it easier for their kids to simply have access to drugs to treat their illnesses. Unfortunately, we haven't yet achieved all we could do for these families, and I've heard time and time again about the emotional roller coaster that many of them have experienced when they interact with the federal government on new approaches for these rare disease conditions. Too often they're unaware when drugs are under review, or confused about why experts or patients are not even consulted. The individuals suffering from these conditions and their families need greater clarity about the process for evaluating and approving these drugs, and they ought to be included and informed every step of the way. It's critical that treatments exist for those with rare conditions and that they be accessible and affordable. We must continue to protect these individuals from discrimination in insurance coverage and work to bring down costs. We have to ensure that incentives designed to spur the development and accessibility of treatments that the rare disease community desperately needs are not abused. Senator Hatch, if you could, with your leadership for so long, with the bill that you passed that helped so many people and saved lives, how do you focus on sharing this message with our colleagues and our constituents?
Well, I appreciate that question. We need to continue to use the FDA to fully implement its relatively new authority. Every one of us in this body represent constituents who are battling rare diseases, and I urge FDA to consider this flexibility is applied in reviewing all candidate therapies. I will continue to work closely with my Senate colleagues to ensure that FDA uses the tools, authorities, and resources required to provide patients and physicians with new treatment options. I've also contacted the FDA frequently during the past year to encourage the agency to listen to the voices of patients during the agency's evaluation process. And when the Senate considers the nominee for FDA Commissioner, I will continue to stress the importance of incorporating a balanced and flexible approach when weighing risks, benefits, and outcomes, especially when dealing with small patient populations with such rapidly progressing prognosis. Patients with limited or no treatment options are depending on FDA to utilize the flexibility outlined in FDASIA. This law, which provides full and fair review of new drug therapies in a timely manner, gives hope to patients suffering from life-threatening diseases and, of course, their families as well. Senator Klobuchar, how can we move forward into the next user fee agreement?
Well, that is going to be very important and really an opportunity to make sure that this works for patients with rare diseases and their families. We know that affordability and accessibility remain paramount. We should also be thinking about the burden that these conditions play and the critical role of the voice of the patient. As you stated, Senator Hatch, more than 7,000 rare diseases exist, and the vast majority have no treatments. This is an extraordinary burden borne every day by Americans in every single state across the country. As we seek to continue making progress, including monitoring implementation of the advances in the bipartisan 21st Century Cures Act, we must ensure that rare disease treatments receive sufficient attention. We also must encourage federal agencies to better incorporate the patient voice in their decision-making process, as I mentioned earlier. All too often, as we rightly focus on evidence-based medicine, we can lose sight of the human experience of these diseases and different therapies. What may seem simple in a lab may be overwhelming or difficult when applied to real patients in real-life situations, all the more so when children are involved. The FDA and all agencies should ensure that they have appropriate processes to seek and incorporate this vital input. And again, the user fee agreement will be an opportunity for us to make this case. I'd like to thank you, Senator Hatch, again for your time to discuss these issues that are very important to both of us. We look forward to engaging with our colleagues on these issues as we move forward with the implementation of the Cures Act, as well as the work on the Orphan Drugs Act, as well as the user fee agreement.
Well, I want to thank you, my dear friend, the senior senator from Minnesota, for your time here with me today. It's very meaningful to me, and I think to everybody who's concerned about this rare disease situation in our country. This is just the start of our conversation for this Congress. There's so much left for us to do, and I'm certain that we will succeed as long as we stay together and work in a bipartisan way. So I want to thank my dear colleague for her words and her support and the good leadership she provides in the United States Senate.
Thank you.